It's interesting that it entered the U.S. by 1999 and was first recognized in New York City. And it's thought to have probably come over into LaGuardia Airport. And not real sure how it got there, whether it was an animal infected or a mosquito in somebody's luggage, literally, or a human infected. But it's primarily a disease of birds. Most birds just get infected with it and just have the virus in their bloodstream and they keep it there and don't get sick from it. Humans are an incidental host, what we call a dead-end host. A mosquito bites a bird and then bites a person, and the virus from the bird is injected into the person. The person can get sick from it. Of individuals who are bitten by a infected mosquito, and not all mosquitoes are infected, it's just a certain few, they have about a 1 in 150 chance of actually having anything happen to them. So about 1 in 150 people will get sick from this. Most of the people who get sick will get something called West Nile fever, which is kind of like a flu-like illness, may or may not have a headache to go with it, may or may not have a skin rash. And of those, a small minority will go on to develop what's called West Nile encephalitis, which is a version of the infection that inflames the brain. And that's the portion of the disease that actually makes people very sick or kills them. So the main people who are getting really sick from this, again with some very pronounced exceptions, are older people or people with problems with their immune system. Again, the encephalitis, usually the first thing you see is what's called altered mental status. You may see on TV where people will say, my husband was watching NASCAR and fell asleep in his chair and then I couldn't wake him up. Or people will have stiff necks, bad headaches, and then altered mental status. Some of them have almost a polio-like illness where they have a weakness in muscles. There's not really any treatment for it, just supportive treatment. There's not any antibiotics or antivirals that work on this. So the treatment is entirely supportive. And most people who get the encephalitis have some kind of injury they carry away from it. Most people have some residual neurological dysfunction. So it's a severe enough illness that virtually everybody is affected who gets the inflammation of the brain. Prevention is mainly avoidance of insect bites. The main mosquito that carries this is adapted to live around humans. And it likes to breed in very small amounts of water. We're talking like a tablespoon of water it can breed in. And to prevent the Culex mosquito from being around you, it's important that people recognize that and go out and, particularly after a rain, and drain anything that has standing water in it. The bird bath, if you have somebody throws cans in your yard and there's a little bit of water left in the cans need to be picked up and emptied. Old tires can collect water. Even the bottoms of the pans underneath potted plants outside can collect water. Mosquitoes will breed in that. Then if you're older or immunocompromised, stay inside late afternoon, early evening. If you have to be outside, long sleeve clothing and using DEET as a repellent on exposed skin.